Hello everyone. Today we're from SGD B2. We will present our student project entitled Fat Soluble Vitamin in IBS. So without further ado, we will start our presentation. Thank you.
Hello everyone, my name is Iswari with the last digit student number is 118. Today I would like to explain about the background of our student project. Irritable bowel syndrome, or IBS, is a gastrointestinal problem that has been faced around the world by approximately 5% to 10% of the community. IBS occurs more often in women and among people under the age of 50. The common symptoms of IBS are stomachache and irregular defecation, form, and frequency. These common symptoms are considered IBS only if this happened for 6 months. In several studies, post-acute enteric infection is said to be the most possible risk of getting IBS, even though there are several cases which were not triggered by acute enteric infection. It has been said that the prognosis is revealed better in IBS without acute enteric infection compared to IBS with acute enteric infection. Patients with IBS were found to have lower vitamin D in serum compared to healthy people with no IBS. Decreased vitamin D concentration in plasma may lead to weaker mucosal barrier function as the result of pro-inflammatory cytokines activation due to lower substance present to manage enteric homeostasis. Vitamin D is one of fat-soluble vitamins, which plays an important role in IBS. Other studies also found that children with vitamin A deficiency have high rates of diarrheal infection, which may also be related to IBS. Knowing the correlation between fat-soluble vitamins and IBS, but then better understanding of fat-soluble vitamins and IBS should be conducted. This paper aims to explain more about fat-soluble vitamins and IBS, which may benefit healthcare professionals to diagnose and treat patients with IBS. That's all from me. Thank you.
Hello everyone. So my name is Tjokorda with the last 3 digits of my student number is 165. And now I will explain to you about the problem formulation in our student project. So there are some of problem formulation that we got, such as what is the meaning of fat-soluble vitamin, what is the meaning of irritable bowel syndrome, what is the method of journal searching that is being used, how is the digestion and absorption of fat-soluble vitamins in patients with irritable bowel syndromes, what is the RDA of fat-soluble vitamins in patients with irritable bowel syndromes, what is the possible risk that is related to nutrition problem that might develop in patients with irritable bowel syndrome, and last but not least, what is the nutrition approach to help solving the problems in the patients with IBS. Next, I will continue explaining about the objective of our student project is to knowing the general description of fat-soluble vitamin, knowing the general description of irritable bowel syndrome, knowing the method of journal searching that is being used, knowing the process of digesting and absorption of fat-soluble vitamin in patients with irritable bowel syndrome, knowing the RDA of fat-soluble vitamin in patients with irritable bowel syndromes, knowing the possible risk related to nutrition problem that might develop in patients with irritable bowel syndrome, and last but not least, knowing the nutrition approach to help solving the problem in patients with irritable bowel syndrome. And lastly, I will explain to you about the benefits of our student project is to able to describe generally the meaning of fat-soluble vitamin, able to describe generally the meaning of irritable bowel syndrome, able to describe the method of journal searching that is being used, able to describe the process of digesting and absorption of fat-soluble vitamin in patients with irritable bowel syndrome, able to describe the RDA of fat-soluble vitamin in patients with irritable bowel syndrome, able to describe the possible risk related to nutrition problem that might develop in patients with irritable bowel syndrome, and last but not least is to able to describe the nutrition approach to help solving the problems in patients with irritable bowel syndrome.
Hello everyone, my name is Putu with the last 3-digit number 103, and now I'm going to continue our presentations about our student project. I will talk about the definition of fat-soluble vitamin. Vitamins are micronutrients that are needed by the body for growth and development. There are 2 types of vitamins, which includes water-soluble vitamins and fat-soluble vitamins. Water-soluble vitamins are usually excreted from the body quickly as they are soluble in water and are excreted by urine. In contrast, fat-soluble vitamins are usually stored in body fatty and liver tissues. There are 4 types of fat-soluble vitamins, which is vitamin A, D, E, and K. Vitamin A includes retinoids such as retinol, and retinol ester, and carotenoids such as beta-carotene. And then there's vitamin D, which includes 2 substances, ergosterol, which is vitamin D2, and cholecalciferol, which is vitamin D3. And then vitamin E, there are 2 types of substances included as vitamin E, which is tocopherols, which includes another 4 subgroups, and tocotrienols, which includes another 4 subgroups. And last, vitamin K, which is divided into two, which includes phylloquinone and menaquinone.
Hello everyone, my name is Daiva, student number of 2002511011. So today I would like to explain about the irritable bowel syndrome. Irritable bowel syndrome is a chronic gastrointestinal system disorder characterized by abdominal pain or discomfort, bloating, and changes in bowel habits that affect the regulation of the gastrointestinal system, visceral perception, and also mucosal integrity. The diagnostic criteria that is used to diagnose IBS is the Rome 4. The main problem in IBS is a decrease in the quality of life of the sufferer. Although it is not related to the progress of IBS, this is more serious and can cause mortality.
Greetings, I'm Dhiyo and my sudden identification number is 20025111133. We search our articles through PubMed, Science Direct, Nature Reviews, and Google Scholar database and search engines. Search results are filtered as such. It's published 5 years ago or sooner, full text available, and is written in English. The search was performed on May 20th, 2022, using the following search keywords: fat soluble vitamins, vitamin A, vitamin D, vitamin E, vitamin K, and irritable bowel syndrome. Keywords are combined using OR and Boolean operators to find articles that cover the association between fat-soluble vitamins or its constituents and irritable bowel syndrome. Articles are collected only to satisfy information needs, and we did not explore through all available data regarding the topic. An article published by the Ministry of Health is referenced even though it is outside of the search criteria to provide the recommended daily allowance used in Indonesia. Thank you.
Hello everyone, my name is Khasandra with my last 3 name digits 152, and I will be explaining about the digestion and absorption of certain nutrients, where in this part of student project we'll be discussing about fat soluble vitamins such as vitamin A, D, and E. So first we'll be discussing about digestion and absorption of vitamin A, and as shown as the scheme shown in the slide, dietary vitamin A is derived from animal sources in the form of retinal esters, or it can be derived from pigmented vegetables and fruits in the form of carotenoids, specifically beta-carotene. Under normal circumstances, the majority of vitamin A is absorbed by intestinal juices and bile salts in the gut. So in the intestinal lumen, retinal esters is hydrolyzed to retinol and free fatty acids by a specific brush border enzyme before being absorbed by intestinal cells. On the other hand, beta-carotene uses passive diffusion to enter the enterocytes, and its absorption depends on the amount of dietary lipid intake. Beta-carotene is then symmetrically cleaved to be transported into retinol, to be later converted into retinol as the final form of vitamin A, which is then further esterified into retinol esters and then merged with chylomicrons and secreted into the lymphatic system. In addition, small quantities of dietary retinoids are converted into retinoic acid, a form that is absorbed directly into the blood circulation and as a biomarker for vitamin A as well. So in the liver, up to 70% of dietary retinoids are taken up by parenchymal cells stored in the form of retinol palmitate, retinol esters, and then rehydrolyzed into retinol by a number of enzymes, including retinol ester hydrolase. The retinol released from the liver can be distributed into a number of body cells for physiological functions by binding into certain proteins such as RBP, that is retinol binding protein, and TTR, that is thyroxine binding protein transthyretin, as vitamin A has a hydrophobic property. So the next, we'll be discussing about the digestion and absorption of vitamin D. The two main forms of vitamin D is, the first is ergocalciferol, or as we know, vitamin D2, derived from plant sources, UV irradiation, or dietary supplementation. The second form is called cholecalciferol, or as we know, vitamin D3, derived mostly from sunlight exposure and a small amount from animal sources.
Okay, my name is Phoebe Escala with student ID 169. I'm going to explain about the digestion and also absorption of vitamin D. Many factors contribute this endogenous synthesis, such as skin thickness and color, the period of sunlight exposure, and also the season. The C9, C10 of provitamin D3 is broken down to form pre-vitamin D3 in the malpighian layer of the skin during exposure to UVR. After that, the pre-vitamin D3 is spontaneously isomerized to vitamin D3. Once synthesized, vitamin D circulates through the bloodstream by binding with vitamin D binding protein to reach the liver, which is then hydroxylated by cytochrome P450 enzymes to form inactive 25-hydroxyvitamin D3, which then further hydroxylated to 1.25-dehydroxyvitamin D3 in the kidney, which is the active form of vitamin D3. Next, I'm going to explain about the digestion and also absorption of vitamin E. Vitamin E is differentiated into two types, such as alpha tocopherol and also gamma tocopherol. Its absorption takes place in the human small intestine that is amplified by the presence of dietary fat intake. The process of this vitamin absorption requires the combination with micelles together with the influence of bile salt and also pancreatic enzyme to enhance its solubility. The absorption takes place in a passive diffusion manner in the enterocytes, where micelles integrate with chylomicrons and is later secreted to the lymphatic system. In the circulatory system, chylomicrons are hydrolyzed by lipoprotein lipase to mediate vitamin E transport to target tissue, such as brain and also muscles. Vitamin E is metabolized in the liver, and only alpha tocopherol is resecreted into the blood circulation, then transferred by lipoproteins such as VLDL and also LDL to target tissues.
Greetings everyone, my name is Adiva Buana Pratama with 3 last digits of student number 146. Today I'm here to explain about the RDA or the recommended daily allowance. So the recommended daily allowance or RDA is the intake level of essential nutrients that the Food and Nutrition Board has determined to be sufficient to meet the known nutritional needs of virtually all healthy individuals based on scientific evidence. And it applies to most individuals regardless of their the first one is weight, the second one is dietary restrictions or preference, and the last one is ethnic origin. I think that's all from me. The presentation will be continued by my friends. Thank you.
Hello, my name is Gusti Frangipani Vedanti with the 3 last digit of my student identification number is 064. Today I'd like to tell you about the recommended daily allowance of fat soluble vitamins in person without IBS. Here's a table that we can see about the recommended daily allowance of fat soluble vitamins such as vitamin A, vitamin D, vitamin E, and also vitamin K in many age groups such as infant, children, men, women, pregnancy, and also breastfeeding. Next, I would like to tell you about the recommended daily allowance of fat-soluble vitamins in patients with IBS. Vitamin D, vitamin A, and vitamin E supplementation above the recommended levels shows good impact on patients with IBS, but larger studies are needed to determine the optimal supplementation protocol for those vitamins.
Hello everyone, my name is Yosephina Taji with last 3 digits ID number 087, and now I will going to explain about the possible risks related to nutrition problem might develop. So basically, vitamin A and vitamin D are playing an important role in GI homeostasis. Deficiencies of this vitamin result in microbial dysbiosis, exacerbated colitis, and increased susceptibility to infection of the GI tract. Vitamin D deficiency has been associated with a higher prevalence of immune-mediated disease, including inflammatory bowel disease. Vitamin D plays an important role in maintaining enteric homeostasis. When there is a lack of vitamin D and or its receptor, or VDR, a series of pro-inflammatory cytokines such as TNF-alpha and IFNG can occur and result in weakening the mucosal barrier function, increasing permeability. Vitamin D and or VDR deficiency might play an important role in the pathogenicity of IBS. In many studies, low vitamin D level was recorded in IBS patients and can be attributed to many factors as altered digestive patterns or intolerance to dairy and fatty food.
Hello, my name is Karina with serial number 2002 511003, and I will be explaining about the nutrition, in this case vitamin A, D, and E approach to help solve irritable bowel syndrome. It is important to maintain healthy lifestyle by eating well-balanced diet and be active to stay healthy and prevent illnesses. In some cases, lack of nutrients like vitamins and minerals can deteriorate part of our immune system. Some vitamins like vitamin A, D, and E given in higher dosage can have good impact for IBS patients. Research found that changes in vitamin A status affect the community of bacteria found in the GI tract of humans. Experimental evidence shows beneficial roles for vitamin A in the host response to GI-induced injury and infection, in which retinoic acid or vitamin A increased the expression of the gut homing receptors, which allowed the recruitment of T cells to the gut mucosa. Interleukin-22 produced by innate lymphoid cells 3 or T cells is a protective factor in the GI tract that regulates antibacterial peptides in the small intestines, induce T helper 17 cells expansion in the colon, thus helping to reduce inflammation in the GI tract that causes IBS. Like vitamin A, vitamin D regulates the microbial communities in the GI tract. Vitamin D supplementation improves barial function and induces the expression of the antibacterial peptide cathelicidin in patients with IBS. These vitamins have overlapping and essential functions for the properties for the GI infection, as well as the resolution of inflammation in the GI tract.
Hello, my name is Gusti Frangipani Vedanti with the 3 last digit of my student identification number is 064. I'd like to tell you about a vitamin E approach to help solving the problem. Many studies have reported that use of vitamin E supplementation above the recommended levels can increase lymphocyte proliferation, enhance the type hypersensitivity response, increase interleukin-2 production, and decrease interleukin-6 production. The effects of vitamin E on prostaglandin E2 production by macrophages have been suggested as one of the mechanisms which vitamin E can improve the age-associated decrease in the T cells mediated immune response. It is to be expected that the anti-inflammatory properties of vitamin E can also help relieve or alleviate the symptoms of IBS.
Hello, my name is Komang dari Jaya with my last digit number 037. I will continue the presentations to explain the summaries of our student project. There are two types of vitamin, water-soluble vitamin and fat-soluble vitamins. Fat-soluble vitamins include vitamin A, vitamin D, vitamin E, and vitamin K. Irritable bowel syndromes, or IBS, is a chronic gastrointestinal system disorder characterized by abdominal pain or discomfort, bloating, and changes in bowel habits. Vitamin A and vitamin D status are important for GI homeostasis. Deficiencies of vitamin A and vitamin D result in microbial dysbiosis, exacerbated colitis, and increased susceptibility to infection of the GI tract. Vitamin D has a potential role as an immunomodulator, anti-inflammatory, and antibacterial agent. Vitamin D supplementation improve barrier function and induce the expressions of the antibacterial peptide cathelicidin in patients with IBD. Supplementing children with vitamin A decrease urine lactulose or mannitol levels, suggesting an increase in intestinal integrity.
Okay, everyone, so that's all from our presentation about our student project entitled Fat Soluble Vitamin in IBS. I hope you enjoy our video and our presentation, and we're very apologize if there are any mistakes during our presentation. Thank you and have a nice day.